I think I was.
Okay. Hello.
Okay.
Good evening, everyone. My name is Anindo Mukhopadhyay. I'm the chairperson of Bengali Association of Greater Nashville. We welcome you to the second session of our virtual meetings. And today we are going to talk about diabetes and the future of diabetes and AI. And let me introduce to you our moderator today. So, as you all know, navigating the future of diabetes isn't about technology, it's about leadership. As a visionary AI strategist and trusted C suite advisor, Subhajit Ghosh architects the digital transformation that turn groundbreaking technology into a competitive advantage. His expertise guides Fortune 500 leaders through their most critical challenges, ensuring they not only survive the disruptive landscape but define the future of medicine. In today's discussion, Decoding Diabetes, where AI meets the human body, Subhajit will be serving as a unique dual role, leading his expertise as both our panel's moderator and a leading AI expert. So, with that introduction, I'll hand it over to you, Subhajit Ghosh.
Thank you, Anindo, for this nice introduction. Really like it, like the nice wordings. Thank you very much. So, good evening, everyone. And let me give you a brief about how we are going to progress in our program. So, so we'll start with first we'll welcome all of you, and then we'll do a live poll. That means we would like to understand from where you join. Is it from Nashville or outside Nashville? While I am talking about the program, you can type in the chat that from where you join. Just one word, Nashville or your location. Then we would also like to understand in a word or two, you can put it into the chat, like what diabetes mean to you. Somebody may have it, may not have it, but they might have a family history. They might have seen their friends are having it and having a difficult time. So whatever comes to your mind, just give two words in the chat. We would like to see that. Now, this after we cross the 5 minutes, then we will welcome our panel and we'll talk about how the body speaks. So, all panel member will introduce themselves and talk about their expertise on pain management, cardiology, neurology, nephrology, and diet, and how actually diabetes shape up. And then we'll also talk about okay, what is the AI role in diabetes? And when we're talking about AI roles, we'll, we'll touch upon briefly three topics. One is predictive analysis, then we'll talk about continuous glucose monitoring, and then we'll talk about the treatment plan. And once we complete that, then we'll have a round table discussion with the panels, and then we'll have a rapid fire. And then the very critical and important part, we'll take your questions through chat, and then we'll try to answer those questions. And if something is still missing or unanswered due to the time and all those stuffs, we'll take them and we'll ensure that those get answered in an email, and then we'll close the program. This is a high level information that how we are going to do. Any questions from anyone? Okay, sounds good. Then let me start the program. Let me first go ahead with Dr. Ashok Shah, who is expert in pain management. He'll talk about that how diabetes affects your body and the pain. Ashok da, over to you.
Okay. My name is Ashok Saha. I am in the VA hospital, the chief of the pain clinic. Every day we see many patients with different kinds of pain with diabetes, but most of them have the common diagnosis of peripheral neuropathy. 60% patients from diabetes suffer from chronic pain. Also, in addition to that, they have peripheral vascular disease, and especially they need food care, and a lot of time you have disease condition like ulcer and poor circulation can cause food problems, and that also is a big issue. So definitely, I define diabetes as three things: diet, drug, and discipline. These are the three things we have to always remember that must be followed. And in addition to that, we should have regular checkup. And when a patient comes with diabetic neuropathic pain, we have got a protocol how we treat them. There are a group of medicines that we can be giving them. Most common today is a medicine called pregabalin or Lyrica. There is an antidepressant medicine called duloxetine. These two have been approved by FDA for diabetic neuropathy. In addition to that, we can give the topical capsaicin lidocaine patch. And there is a Qtenga, which is another new form of capsaicin 8%, which can be given only in the doctor's setting. Normally, we avoid any kind of opioid medication for diabetes. And I have many patients who are really completely bedridden because of the peripheral neuropathy. For them, we have got very advanced procedure called spinal cord stimulator, which can be implanted in the spine, and that can take care of the pain. So shortly, this is the diabetes and pain.
Thank you, Ashokda. Really, I like the 3D concept, which is easier to remember but very, very powerful. Thank you for your insights. Next, we'll go to this our cardiologist, Dr. Timir Pal. Timir, over to you.
Good evening, everyone. Thanks for inviting me. It would be an exciting seminar today, or webinar. So I'm Timir Paul. I'm a professor of medicine and program director for cardiovascular fellowship at University of Tennessee, Nashville. After my medical degree from Bangladesh, I received my master's in public health and PhD in cardiovascular epidemiology and biostatistics from Tulane University, New Orleans. I've been practicing cardiology and interventional cardiology for 14 years. Currently, I'm practicing at St. Thomas West Hospital, Nashville. So let's talk about the diabetes and heart disease. Heart disease, not only affecting specifically to the heart, we'll discuss about entirely called cardiovascular disease. So diabetes is the number one or one of the major risk factors for cardiovascular disease. So cardiovascular disease includes heart attack, coronary disease, heart failure, peripheral arterial disease, and stroke. It's not only just heart attack or coronary disease. And it is a silent killer. It causes coronary atherosclerosis, meaning that it builds up the plaque in the heart artery, eventually causing the narrowing of the heart artery that caused coronary artery disease. And that leads to heart attack or MI. It also causes heart failure, different forms of heart failure. So it basically starts with the weak heart called cardiomyopathy, or it can present with heart failure called systolic heart failure or diastolic heart failure or any kind of congestive heart failure. So diabetes is a systemic disease, is a diffuse disease. It not only affects the heart, it also affects the other blood vessels of the body, and it damages the small vessel and large vessels of the body, causes microvascular and macrovascular disease, and it's a slowly progressing disease. As Dr. Shah mentioned, that it also causes peripheral arterial disease. What does it mean? That it is the atherosclerosis or narrowing of the artery or any part of the heart body except the coronary artery. So it not only affects the heart artery, it also affects the other arteries in the body, such as the lower extremity like leg artery, neck artery, or renal artery. If it affects the kidney artery, it causes hypertension. If it affects the lower extremity of the body, like it causes ulcer, wound, or gangrene, and it delays the healing process. If it affects the neck artery, it causes the stroke. So most importantly, the message is that it causes silent MI. You don't feel any chest pain or you don't have any warning signs. Because of long-standing diabetes, your nerve got damaged. So it is the dangerous effect of diabetes on heart. One other things that we should do, if you have a family history of diabetes and or heart disease, you should aggressively and early screen your other risk factors. It's not only the diabetes, it all interlinked, like it associated. So you should focus on all of the risk factors combination, like early and aggressively screen and manage holistically. So that way you can be more effective instead of only focusing the heart disease. Thank you.
Thank you, Timida. It was very, very insightful information, and hopefully our all the members will get benefited from this information. So now we'll move to Dr. Ranjan to Ranjanda, who is our kidney expert. Ranjanda, so over to you. If you do a self introduction and let us know what is the renal red flags in diabetes. Right, a lot of people do not understand initially. We do not see the symptoms, but what are the main red flags that we should look into this so that we can be precaution ourselves and make sure that we take proper care. Over to you, Ranjandar.
Thank you, Shubhajit. Thank you for inviting me. This is a very important topic, and it's at a very crucial point where this disease is becoming an epidemic. Most of you know me informally as Ranjan in the Bengali community, but let me introduce myself formally this time. I did my med school from All India Institute of Medical Sciences in Delhi. Then I went to Buffalo at University of Buffalo. It was called SUNY Buffalo. I did a combined residency program in internal medicine and preventive medicine. I also did a master's of public health there. So I got a master's and two residencies. I moved to Dallas. I did a fellowship in nephrology at Baylor. Then I went to San Francisco at UCSF. I did a fellowship in transplant nephrology, kidney transplant. Now I'm here in Nashville in a private practice, and recently I finished an MBA from Emory. No particular major, but just a general MBA. So I'm in a very busy private practice in nephrology. Our group spans the entire of Middle Tennessee. I run the transplant program at St. Thomas, kidney transplant program at St. Thomas West. We did 150 transplants last year. Me and my other colleague, we managed them. I also, as a general partner, I'm a director of dialysis unit, couple of dialysis units, and have crucial executive roles in my partnership in finance committees, exec committees, governing bodies. Um, I have been a board of trustee at a couple of hospitals as well. I have seen the entire gamut of diabetes from beginning to the end. So when I think of diabetes, let me just say that one thing. Glucose is poison to us. Our lifestyle has changed. We were not eating processed food or simplified carbohydrates so much before. Now we are. It's very enticing. It's good because the body wants it. Body thinks that we are going to go to starvation. So let's eat more. So it is a feedback loop where you get more hungry and you feel more and more you want to take the sugar. You get a kind of high out of it. But how does it affect the body and the kidneys? Two ways. First, the glucose itself, it enters in every cell and molecule and every cell of the body by glycated end products. Glycated end products are just our regular DNAs, molecules, and other substances, proteins that gets damaged by glucose. They get glycated, and they are not normal, and they deposit. They deposit in everywhere: heart, brain, lungs, kidneys, any organ of the body, and nerves. That's how they cause microvascular damage by glycated end products. Second way it damages is by causing an insulin spike. By insulin spike, if you high glucose, insulin spike, insulin causes conversion of glucose to lipid by lipogenesis. And that lipid goes and forms macrovascular disease like atherosclerotic plaques in the heart
and big major cholesterol deposits in the body. So two ways, microvascular, macrovascular. Kidney is mainly affected by microvascular, the glycerate end products. So kidney has a filter, we call gloms. In that filter, in the area where the membrane is, you find these glycerate end products causing nodules and scarring in the kidney. When the kidney gets scarred, two things happen. Kidney function gets reduced, and number two, there's a lot of protein that gets leaked. The weight, the signs of the symptom that you find in somebody getting affected with diabetes and kidneys is swelling in the leg. That's the first thing you will see. Swelling in the leg because of proteinuria, protein in the. And you go to a doctor, you got swelling in the your diabetes, he will do a simple urine test, he will find a lot of protein in the urine. That is the first sign. The more it goes on unchecked, that protein leak and the glycerate end product deposits, causing nodules and scarring in the kidney, eventually causes kidney failure, where the kidney function goes down. Kidney function goes down, and you can find that out by the creatinine, by the blood test that you can check. So urine test for protein, blood test for creatinine. Um, it comes in very saliently. You will not know. By the time you know, it is far too gone. So once whoever has diabetes needs to make sure they get their urine checked and they get their blood tested for creatinine and the protein in the urine every year around the clock. You should do it as the norm, because the earlier you detect, the more you can prevent. And science has advanced a lot in terms of prevention of this protein leak in the kidney. We have three modalities of medication now we call cutting edge. In the last 3-4 years, these medications have come out and they have shown dramatic reduction in overall disease and improvement of lifespan. They are the SGLT2 blockers, Farxiga and Januvia. The second group are the GLP, we all know by the name of Ozempic and stuff. That is more popular for weight loss, but it is very crucial. These two arm, and the third arm we call mineralocorticoid antagonists such as spironolactone or Kerendia, finerenone. These are three arms of treatment that can be done. But main thing is your diet, what you put in your mouth, and how much you put in your mouth, what type of food you put in your mouth, how much you can control yourself, how much you can move your body. Movement, diet, stress control, and just general lifestyle. It starts with that. Then go to your doctor, get your physical, get these things checked, and make sure you are having treated with this three-pronged approach for prevention of further damage. So that's in brief. But as kidney fails, of course, then I deal with the further part, dialysis, kidney transplant. That's a whole different league altogether. But right now we're talking about prevention and how to control the further damage from diabetes. Thanks.
Thank you, Ranjanda. So it seems like that prevention is always better, right? And checking things regularly or periodically will help you to understand where you stand. And definitely, as Ashokda and Timidda mentioned, like a healthy lifestyle makes a lot of difference. So thank you for the insight. So let's move to our next panel member, who is a neurologist, Dr. Sushanta Bandyopadhyay. Sushanta da, I'll send it to you so that we can discuss about how the nerve damage decoded and what are the signals that we can get before it really gone worse. So over to you, Sushanta da, whenever you are ready.
Thank you, Shubhajit, and thank you everyone for joining us for this discussion. My name is Sushanta Bandyopadhyay. I'm an associate professor of neurology at Vanderbilt University Medical Center. I got my basic medical degree from India, and I got a PhD in neuroscience at University of Alabama at Birmingham. Following which I did a neurology residency at University of Tennessee at Memphis. And then I came to Nashville for a fellowship in epilepsy and clinical neurophysiology at Vanderbilt. Then I went to University of Missouri, was there for several years, and then I came back to Nashville to join the Vanderbilt Medical Center as a faculty. So my area of practice is epilepsy and clinical neurophysiology, but I'm a neurologist to start with. So diabetes, one thing I would like to clarify, and we all know that when we're talking about diabetes, we're talking about diabetes mellitus, and diabetes unqualified generally refers to diabetes mellitus type 2. There are some differences, subtle differences, but what I'm going to talk about is mostly um, pertains to diabetes type 2 and also to type 1, because nerve damage is more or less the same in both types. Diabetes damages many organs, like all organs can be damaged by diabetes, and so are the nerves. The damage occurs from basically two processes. One is like Dr. Paul and Dr. Chandu discussed that the microvascular problem. So any organ needs blood supply. Even the nerves, they also need blood supply, and it comes from the microvasculature. So if the microvessels, the tiny vessels that supply the nerves with the blood supply, if they are clogged, then you suffer from lack of blood supply. And so the nerves die. And the other problem comes from the metabolic derangements that occur in diabetes, resulting in multiple different uh, byproducts of the metabolic pathways, and that also has damaging effect on the nerves. So nerve cells forms electrical circuits, and they have processes that can be considered similar to electrical cables. And the first damage starts occurring at the very end of the long nerve processes called axons. So the most common type of nerve damage that we see in diabetes is diabetic polyneuropathy. And it starts at the tip of fingers and tip of toes. So these long nerves, and at their end, they start dying from the very end where from they carry the sensation. So there's damage to those nerves die, and that initially is silent. It doesn't give you symptoms. About quarter of patients who gets diagnosed with diabetes probably has some level of nerve damage by the time they get diagnosed. And 50% of patients with diabetes will have nerve damage during the course of their illness. So it starts as numbness. So you feel, or you don't feel at the tip of your toes, tip of your fingers, and that can progress gradually upward to your hand, to your feet and leg. We often call these gloves and stockings type of sensory changes. So the area where you put on gloves, the area where you put on socks, those areas you don't feel. And then you can have tingling, and then comes burning pain, which sometimes can be excruciating. And also when you don't feel, you can have like if you have an injury, a cut injury to your foot, and you never felt it, then you can get infected without knowing, and that can progress to bad infection, gangrene, and you can lose a toe or a foot or even a limb. So that's that. And then you also have problem with what we call proprioception, meaning the position sense, your body position in three-dimensional space. And you need that to maintain your balance. And when you lose that, then you can have balance issues, falls. So that's another effect from the nerve damage. So that's the most common type, the diabetic polyneuropathy. But diabetes can damage any nerve pretty much. The next common set of nerves that are commonly damaged in diabetes is probably the autonomic nerves. The autonomic nerves are the sympathetics and parasympathetics. These nerves regulate the bodily function that we're not aware of on a daily basis, or we are not exactly in control. But these nerves work to maintain body processes like heart rate and the motility of the gastrointestinal tract, etc. So a common or not uncommon problem in diabetes is orthostatic hypotension. Like the blood pressure falls, or there is an exaggerated response to standing up. When you stand up from sitting or lying position, your blood pressure typically drops. But in autonomic nerve damage, you can have an exaggerated fall of blood pressure that can cause dizziness or unconsciousness. Another thing that can happen because of autonomic neuropathy is, like Dr. Paul discussed, silent myocardial infarction. Like you have heart attack, but you don't have any pain, so you don't know. And also another thing is hypoglycemia unawareness, meaning in diabetes, patients take glucose lowering medication, and if your blood glucose falls too low, then you have hypoglycemia, which can be dangerous, and it can potentially kill you. So it's important to be aware of hypoglycemia. And one way of patient knowing that they're getting hypoglycemic is there's increase in heart rate, there's sweating. But if there's autonomic neuropathy, then these things don't happen. There's no increased heart rate, no sweating in response to fall in blood glucose. So you can get hypoglycemia, but you're not aware, and you cannot take glucose to correct that. So the bottom line is diabetes is a complex metabolic disorder. It can damage the nerves and pretty much any nerves. And again, this DDD, diet, discipline, and drugs. You need to have all of those together to fight that. Thank you.
Thank you, Shushantada. And the DDD comes back repeatedly in these discussions. And the information that you shared, probably if I get a chance, I will have a question because you raised really some critical points. And one of the things I would like to understand later point of time when we'll be having a question and answer. Thank you for all the insights. Now, Bengalis are usually foodies and we love to eat, right? And we know known for our food habits in the world. So now we'll go to our dietitian, Rita Bandyopadhyay, who will unpack for us how we can eat and still adhere to DDD. Rita, over to you whenever you are ready.
Yes, thank you. So many of you, of course, already know me, but just a quick recap on my background. I'm, of course, Rita Bandyopadhyay, grew up in Nashville. I have a bachelor's degree in neuroscience from Rhodes College in Memphis. I went on to get my master's in exercise science and nutrition from Lipscomb University, and I'm currently pursuing a master's degree in clinical psychology from Pepperdine University, which I'll graduate from in December. So I have a pretty extensive background with nutrition and mental health combined together. As a dietitian, I specialize primarily in eating disorders and mental health nutrition. And with that, I also often work with PCOS, polycystic ovarian syndrome, and diabetes, two conditions that are, of course, very we talk about blood sugar a lot with both of those and how nutrition impacts blood sugar. Specifically, when we're thinking about diabetes in the context of mental health, especially, oftentimes when I'm working with clients, a lot of the time they come in and they say, I just got a diabetes diagnosis, and honestly, I'm just really scared. I don't really know what to expect. I think there's a lot of fear rhetoric around diabetes and how to manage it. Not saying that fear isn't important, quote unquote, but really emphasizing that there are a lot of things that many of our other panelists have already talked about that can be really helpful and sustainable with managing nutrition, making sure that we have a healthy lifestyle, being really active, managing stress, having enough sleep. All of the above can be really, really helpful for all of these things. And also really taking out the stigma of, often I hear the words, diabetes is my fault. Because there's a lot more to diabetes than just, I ate too much sugar or I ate too many carbs and therefore I caused this. Of course, We want to be really mindful when we're thinking about carbs and sugar consumption, because as again, we've talked about with all of our other panelists, they do really impact our bodies a lot. And we want to be really intentional with how we're using our words, especially as healthcare providers, to not instill fear, but to instill empowerment in our clients and our patients. So, with all that being said, we're thinking about it from the nutrition context and also from the mental health context. We really want to think about not just saying low carb is the answer, low sugar is the answer, but also how can we support when we're eating carbohydrate foods, support our entire nutrition with that. So simply being, whenever we're eating carbohydrate foods, we really want to make sure we're balancing with any foods that have protein in them and then have fats in them. And of course, fiber is very important as well. We're thinking about fiber foods. Of course, we're thinking about fruits and vegetables. So really emphasizing those kinds of foods can balance out all of those carbohydrates that we're eating. And if we think about our human body, we only have so much space in our stomach when we're consuming food. I always like to emphasize the volume aspect. We can really only eat so much. So if we're really being intentional about protein foods, fats, and fiber, we're automatically going to change our ratio when it comes to carbohydrates, and then we can better support how our body utilizes blood sugar so we can prevent any spikes from happening consistently and also the damage that those blood sugar spikes cause. That is where I will stop for right now.
Thank you, Rita. This is very, very insightful as always. And that raised also a couple of questions, and I'm pretty sure that will come from the participants. And I also have a question that I will reserve for you because I am a foodie. I would like to know a little bit more on that side. Okay, we are progressing well on the timeline side. Now I wear my AI hat, and we will discuss about hey, how AI could be the game changer. And couple of you know that I love storytelling, right? And I do that with all my clients. I do not get into the initial technical details. First, I tell them some story. So today I will tell you three short stories. One is from predictive analytics, and then continuous glucose monitoring, and then personalized treatment plan, right? How actually AI is working in this segment. And before jumping into that, I would say that AI is transforming whole healthcare system. There are a lot of studies out there. In few years, the AI market in healthcare will be around 4.1 trillion, and there are so many, more than 4 trillion, I would say. I'm not go in very tough number, but there are a lot of studies out there. There are some difference in the number, but I would say that everybody is banking very big. And the three things they are banking big are predictive analytics, and then continuous glucose monitoring, and personalized treatment plan when we are talking about diabetics. I'm not talking about AI as a healthcare because that has some different uh, areas to cover, and our focus will be today on AI in diabetics. So now what is a predictive model? It's a data model, but what exactly it does? What it does, it imagine that you are going to a doctor and telling that hey, I have some problem, doctor, do some test, and then you diagnose as a diabetes and you get some medicine, and then as everybody has mentioned here, 3 days you have to follow that, right? So that your diabetes is under control, otherwise it will have a severe impact on all your body. But predictive analytics is something different. What it does, it has a model. Imagine that that's kind of a machine. Okay, it's not exactly machine, but imagine that's a machine with a lot of power. What it could do, suppose you have a hospital and you have a records of probably 20,000, 50,000 diabetic patients, right? So all these informations are fed into that system, and once the information is fed, so it can identify some pattern, and it can say that okay, this patient has a diabetes, or maybe it's a pre-diabetic, but there is a chance down the line, 10 years, because it can predict whatever normal human eyes cannot predict, that slight change of any pattern, and that pattern with genetic things they will take and ensure that oh, with this pattern they'll compare another million of records and say that oh, if this pattern is there, then there is a chance of stroke on so and so time. So what will happen when doctor will revisit those information, they can guide those patient in more appropriate, or maybe more restricted, or maybe more open lifestyle. I'm talking about bad, but it could be a good also, right? Okay, maybe over the period of time he has a healthy lifestyle and he is doing good. So those kind of analysis are really really hot in AI, and that calls the predictive analysis. Now, let's come to the continuous glucose monitoring. Those who have diabetes, and if they are having this for years and years, they know of the pain of managing their diabetes, or taking where their sugar stands in couple of times a day, every couple of hours, right? Maybe morning and after meal, evening. So there are always some challenges, but now that challenge has, I would not say completely gone, but there is a solution to it, right? You can put a tiny little machine in your arm, and what it does, it will not only take your eating habit, but it will completely work on your body. It will understand what is your stress level, what you eat, how you walk, how you do exercise, what is your feeding pattern, what is your work life balance, and what is your I mean to say, I already said about the stress levels, right? Even it can also count your Sunday naps, like you are taking a Sunday naps. Taking all these into things and blending, suppose that I am preparing my meal, but suddenly I saw a beep in my mobile phone and said that hey, there is a glucose drop predicted in 30 minutes. So based on that, I can adjust my meal. I may be adding one sweet, so that my diabetes level to be up. Now, how this happen? It happens with your body, and there is an app. What it does, it takes all the data. AI means data. Nothing can be done without data. So it takes all your data, all your information, and then process that data through cloud, and then in the cloud they have some algorithms, I would say. It's easy to understand. With that algorithm, what they does, they create those information for you. You do not need to go through this painful process of taking blood and okay, checking your glucose level. So that's the, I would say, really, really helpful for all the diabetics patient. If they put it, that will help them to understand their body. And it's not only food related things; it takes all your body. Now, to get back to the third story, what is that personalized treatment plan, right? Like for example, our body is different, everybody's body is different, right? So whenever we go to a store and buy some dresses, it's very generalized, right? We have some size and we buy that. Why the designer dresses look so good on people? Because it's tailor made. So everybody's body is different, so one size doesn't fit for all. Similarly, one treatment plan will not fit for everybody. So that's why what it does, it continuously doing the same thing. That means it's a different model, um, analyzes all the data, and then probably looking for the your genetic order, because everybody's gene is different, right? It looks for your genetic orders, tiny shift your bloodstreams, and trying to find your lifestyles and all those stuffs, and then it predicts like what should be your treatment plan. So in cancer treatment, this particular model works really great, and they got really good results, and they're implementing in different areas as well. So diabetes is definitely one of them. So the treatment plan can be individualized to the basic need and the outcome of the AI model. So these are the three things that I would like to touch upon, and then we will go back, and I will wear my moderator hat again, and I will go back to the panel discussion now. And the theme of the panel discussion is what is absolutely do's and don'ts for the diabetes. So I would like to start with Dr. Ashok Shah, and then we can jump and discuss. Ashok, over to you. If you can say a few words like what is absolutely do's and don'ts for diabetes. Ashok, unmute. Okay.
Okay, now
Oh,
you can
Ashok,
hear
you are
me.
here.
Okay,
Okay.
okay. So simply, I would say very common thing. One is should not do and must not do if you have diabetes is use chappal, like all Bengalis like it. But do not use chappal, do not use open shoes, because if your feet get injured, then healing will be late, delayed, may get infected, and the combination of neuropathic pain and lack of vascular supply will make it long. And actually, there are situations, again, without, don't want to create panic, but it may ultimately go to gangrene. And then we have many patients who has gone through amputation because of simple negligence of not wearing the proper shoes. I think proper shoes is the number one thing that you should do.
Okay. And Ashok, if you wanted to say about one myth you want to bust on diabetes, what would be?
One what?
One myth, like people have a lot of myths on diabetes, right?
One myth that we want or we don't want.
No,
No,
so there are a lot of myths around the diabetes, right? People say that, okay, if you eat sugar, a lot of sugar at your early stage, that is the reason of diabetes, which
okay.
might not be true.
I would go back to our social situation. If you consult anybody from India,
Mhm.
everybody will have lot of totka, lot of things like eat this, take methi, eat karela, and all these things. They have no scientific studies done on any of the Indian food or spices except few, which is already we can get, like turmeric and others. But whatever we should always avoid the so-called Indian cure of diabetes, because if you know that the the Indian population in US has much higher number of diabetes, and I have just got through that. Uh, the South Asian origin in India, the diabetic percentage is 10.8%. Chinese American is 7.1%, and Japanese American is 6.8%. It also starts at younger age in Indians and even at lower BMI. So this is very important thing to remember, that we have higher incidence of diabetes, and Indian remedies should be always judged with a grain of salt. Thank you.
Thank you, Ashokda. So just to keep us on time, so we'll try to go a little faster. So let's go with Timidda. So Timidda, according to you, what is absolutely do's and don'ts, and what is one myth you want to bust from diabetes?
Sure. So as I mentioned and reiterate again that absolutely you should do aggressive risk factor screening as early as possible, including high blood pressure, high cholesterol, especially you already know whether you are obese or overweight and you are smoking or not. Those are all risk factors, but particularly high blood pressure and high cholesterol. And also, one thing that you should do, all diabetic patients should be on cholesterol medication, especially a statin group of medication. And no matter what is your cholesterol level is, if cholesterol level may be normal, still you need cholesterol medication. That's the two things. If you have a family history, diabetes or heart disease like MI or stroke, you should screen them, like especially simple tests. Don't wait. Don't wait for, oh, I'm not having symptoms, so I'm fine. My diabetes is controlled, so I'll be waiting. So you can do a simple stress test like a treadmill, walking treadmill. So although if you don't have chest pain, you can find that whether you have a shortness of breath, whether you have any fatigue. So those kind of symptoms may be early signs of heart disease. Or you can do an EKG to make sure that your heart muscle is not thick enough. Or nowadays we can early diagnose with the blessings of AI that simple echo, we can say whether you have cardiomyopathy or weak heart or not. Very simple test. So those are the things that you should not do or you should do. One myth that I would say, I mentioned that everybody should be on cholesterol medication, no matter what, if you have a diabetes. But people think that, okay, if I take cholesterol medication, it causes dementia, it causes memory loss. It does not cause dementia, it does not cause memory loss, no matter how low is your bad cholesterol or cholesterol is. And also that if you take the cholesterol medication, it improves your cardiovascular outcomes. So those are the things you should do.
Thank you. Thank you very much, Demetria. So I'll go to Ranjanda now for absolutely do and don'ts and one myth that you want to bust.
Absolute dose, I will say in nowadays, CGM, continuous glucose monitoring. You can tell by the CGM, you can real time look at what you eat and how it spikes your sugar. And you will see that simple carbs or a cookie, even our bhat, rice, it's such high carb index in glycemic index that it spike the glucose so much. So you can experiment around. Your goal should be not to cause a spike. If your glucose spikes, then it spikes the insulin. It causes all the problem is from the insulin actually. Insulin causes a lot of metabolic problems eventually. You want to rest the insulin. You want to rest the insulin and rest the pancreas, and you can see how your glucose is changing with what you eat, and you can experiment around, and you'll be surprised to see which are good food, which are not. Veggies and low carb other stuff is so good. It does not even spike at all. We talk about red meat is bad, or all kind of meats and stuff. You'll see that maybe they're not as bad as one rasgulla. Maybe a steak is better than a rasgulla for diabetes. I'm not kidding. And that's you can see the spike. So you can experiment around by that way. Myth, I would say, Bengalis are a fan of homeopathy. Please do not do homeopathy. That's a big myth.
That's
That's all I would
interesting.
say. Yeah.
Okay.
Okay.
Thank you, Ranjanda. So we'll go to Shishantada for a quick thoughts on absolute do's and don'ts and one myth he would like to bust.
So, from NORB standpoint, I'd say one absolute do is check your feet every day. Best time to check it. I mean, if you're a diabetic, you should check your feet thoroughly. And the best time to do that is at bedtime. So take a look. Is there any injury? If there is any infection growing, anything there, and keep your feet clean. And the other do is like be in regular follow-up. See your doctor do the tests that are recommended, look for any complication that may be developing before it goes out of control. Now, about a myth, it's not exactly myth, but what I want to emphasize is that high blood glucose is not equal to diabetes, or diabetes is not equal to high blood glucose. That's just part of the story. Blood glucose is a marker of diabetes. Diabetes is a complex metabolic disorder. A lot of things gets deranged. Oftentimes it's part of the metabolic syndrome that includes like central obesity, elevated lipids, or deranged lipids rather, hypertension. So the approach to treatment is multimodal. It's medication to lower blood glucose because elevated blood glucose has its consequences, but also controlling lipids. And like Timir said, that even taking statins even without hyperlipidemia is beneficial. Maintaining healthy body weight, exercise, sedentary lifestyle is a killer, and we are all guilty of this. I mean, not all, a lot of us are guilty of that. So the point I want to make is that the management of diabetes has to be from multiple angles. Control the blood glucose, maintain healthy body weight, exercise, and see the doctor, do follow up. Don't develop any dietary fad that I will eat this is eating this is good, so I will eat a lot of that, maybe whether Karela or whatever. Eat a balanced diet. That's always helpful.
Thank you. So now I'll go to Rita because I think she will find it very difficult for me, right? Because of this, all these food and all those things, what to choose and what not to choose in a very short period of time. So Rita, over to you for absolutely do's and don'ts from nutrition or a dietitian perspective.
Honestly, the myth I want to break is a low carb diet fixes diabetes. And I want to say that, and I'm going to expand on that, obviously. I had a client come in one day saying, I have not had anything today except for a strawberry. One strawberry, a very, very low carb diet. And guess what? Her blood sugar spiked because strawberries have carbs in them. And carbs alone are going to spike your blood sugar. So there's a large misconception, I think, when we say the words low carb, that it means low carb is not going to have spikes. Instead, we really need to emphasize it's not just about low carb, it's about making sure we're balancing the carbs out. Because you can eat, if you just eat strawberries all day, strawberries are probably going to have more carbs than some other types of specifically vegetables might have. But it's still going to spike your blood sugar if that's all you're consuming, because strawberries at the end of the day still have carbs in them. So what we heard earlier, a steak might actually be more helpful, not because it's a steak, but because steak has a lot of protein in it, and protein is going to spike your blood sugar a lot less than just eating a bushel of strawberries will. And again, this is not me saying please just go eat steaks all the time. I am not saying that. What I am saying is whenever you're making intentional choices with your meals, we want to have carbs, proteins, fats, fruits and vegetables, and please enjoy your meals. Because we talked about earlier that mental health is going to be a really big factor here. If you are not enjoying your meals, you are not going to stick to this nutrition plan. You're going to say one day, I'm tired of this. Let me just go eat mishti all day, because guess what? That brings me much more joy. So being really intentional about all of those different pieces, you will find that you actually really like having a salad every once in a while. That is actually really yummy and really exciting, especially as you notice my blood sugar is not spiking as much. My body feels a lot better when my blood sugar is not spiking as much. Also, on the other side of blood sugar spiking, since we are talking about it, every person's body is really different from one another. I know CGM was mentioned earlier. CGMs can be really, really helpful, especially with people who are either pre-diabetic or have a recent diagnosis of diabetes, to start figuring out what are those foods that cause spikes. Some people are going to have more of a spike from certain foods than other foods, and vice versa. Somebody else might have no spike from one thing that another person has a lot of a spike from. So start getting that data. Data is power at the end of the day. We want to feel really confident with the food choices that we're making. And it is okay for us to kind of move away from that every once in a while. Again, please don't eat French fries all day, every day for the rest of your life. It's not going to help you with your blood sugars, but every once in a while, it's definitely okay. Just make sure to balance it out. Also, we're thinking about blood sugar and spikes. It's really important for us to be considering variability over the course of the day. A lot of the times with the rhetoric of low carbs, we think about, okay, I'm going to save my carbs for the end of the day. So we end up having really low blood sugar all day long, and then we've saved our carbs for dinner. Guess what? Our blood sugar is now spiked at dinner time. Not very helpful to our body. It's actually going to be more harmful than anything else. So we want to have a lot of consistency. Make sure you have about the same amount of carbs, breakfast, lunch, and dinner, snacks during the middle of the day, and about the same amount of balancing out each of those meals. It's going to really help with the variability of your blood sugars over the course of the day, and preventing any of that damage to your.
Thank you, Rita.
Mhm.
Really appreciate that. As a moderator, I was thinking to should I put the Grammy music of the timing? Then I was thinking this is so informative and it will help everybody. So fair enough. And then I will wear my AI hat again. So I will say what is absolutely do's is, as everybody said, look for the CGM part. That we definitely need to work it out. And then when I will say don'ts, everybody has a thought process. AI is kind of a god and they can do everything. No, AI has a lot of limitations, especially when I was talking about this predictive analysis and other stuffs, right? Personalized treatment plan. Everything goes through a lot of model, and how this model build, it depends a lot. Now I'm not getting into the technical details of model. I will give you an example. Like when an architect build your house, it lot of matter on the reputation or the knowledge and expertise of that architect, right? So in the market there are a lot of architects. So couple of architects probably just to plan it out takes millions of dollars, and couple of architects you can get probably couple of $1,000. So AI model is something like that. You need to understand from where you are getting this information. So that makes a lot of difference. Now XYZ, everybody is coming up and telling, hey, I am building a model on predictive analytics, and not everybody understands what goes inside and what comes out, right? So AI can do everything? No, definitely not. So that is the absolutely don'ts, and pay attention from where you are doing, what exactly you are doing, and what exactly you wanted to do. Now, coming back to the myth, I will say that there are a lot of myths like, oh, CGM can track everything. CGM can tell me when my sugar spike, when my sugars drop. So this eventually will replace doctors, right? Why I need a doctor? Definitely not. AI cannot replace doctor. And if I have to give some analogy, you need to understand what is AI. Imagine AI is a microscope who can read, process tons of data which our normal human eye cannot understand. But once the data information is there, AI cannot do anything. AI cannot understand what exactly next level to do, what is the context of that data, and how to treat that data, and how to read that data. So that part of level AI still has not reached. So you need to still work on with your doctor, but AI will empower your doctors to take better, informed, and more correct decisions. So that is an absolute myth. I wanted to ensure that I clearly specify to everyone that AI cannot do everything, but yes, AI can help you out in today's things. I know that we are a little over, but we predicted that probably will go 15 minutes over. And with that, now I will open question answer. Is there any questions on the chat so far? Shubhajit or Anindo?
So the questions in the chat are mostly answered, but we can go and pick them up if anybody wants to add anything.
Sure.
So
Uh,
I'll go through the questions and see if anybody wants to add anything. Uh, so let me read the first one. Sorry. What are the, so there is a question from, I think from Priyanka, which was answered. Someone actually had asked a question. What are few modifiable risk factors for diabetes? Anybody wants to talk about that?
Well, the main risk factor that I think is basically our own lifestyle, our weight, our how much we're moving our body, what is our diet and smoking, the regular risk factors. Any modified risk factor that is for cardiovascular health, same for diabetes, really. So it's the same thing. Healthy diet, healthy life, exercise, keep your weight in check, don't smoke, don't drink, and that's pretty much it.
Thank you. There is another question. Is intermittent fasting good for diabetics? What are the negative impacts of intermittent fasting on the different organs of the body?
I'm a big fan of intermittent fasting, actually. I've done a lot of research and reading, and I do it myself. And I think it is very good. What you need in diabetes is a prolonged time of rest of your pancreas and not put food inside you. It takes 12 hours to break down the glucose in your blood and your glycogen in your liver. Then only the fat burn starts. And you have to start burning the fat that is deposited in your abdomen, in your pancreas, and on your liver, visceral obesity. The only way to do it is prolonged not eating. And what are the risk factors? Those who have issues like hypoglycemic unawareness, advanced diabetes, type 1 diabetes should never fast. So those are the exceptions. But in general, for the most part, people who are little obese, little sedentary, uh, lose weight. 10% lose weight, your A1C will melt down by a couple of points right away. And it is proven, and there is a lot of data behind it. We need to eat less and just prolong fasting. So
Thank you. I think this is a question for Rita. What is the earliest age to test for diabetes? Asking for children and teenagers.
So, I mean, generally speaking, and this might be different at different people's practices, but people should be getting complete blood panels whenever they go to the doctor. If you're not, I definitely would ask for that, but a complete blood panel will have your fasting blood glucose, potentially also an A1C. Sometimes it's one or the other. And those are going to be the main tests for diabetes that we're going to be looking at from the beginning. Potentially there could be other things that we're looking at over time if we're seeing consistency with high numbers. But that's going to be the first line that we're looking at. And it should be happening, if it's not, from a very young age. But any of our doctors on the call might have better information on that.
No, I think it should be as
How early? Sorry, Timir.
no,
How?
no, it's as early as possible. Like when you start seeing a doctor, is just it's regular blood sugar be there. Like if you check simple, we call BMP, the blood sugar is there. So if your blood sugar is normal, you just keep once a year, keep checking it.
So as early as 16 years of age, we can ask the doctors to do a blood test for our children.
I mean,
yeah, because
even going to see a pediatrician should be getting a complete blood panel. So
Like 5 years?
potentially if they're getting their labs drawn.
Okay.
Thank you.
Thank you.
Because you may have type 1 diabetes and it starts so early, and you don't know until you check it.
So basically, it is kind of an hygiene. Whenever we go for yearly checkup, we should include that, no matter what age it is.
I'd like to ask a quick question to the panelists, doctors. This is Soman Ghosh. Are you guys using AI in your daily practices? Because this is an interaction between AI and diabetes. The question is to the doctors, are you guys using at all AI in your regular practices?
Shomanda, I just answered. We don't use it all because the management is so obvious, and the low hanging fruit, like basic stuff that needs to be done, sugar control with diet and medication, it is so obvious. We do not need any form of complex decision making at all at this point of time. So no AI needed. It's not the same as diagnosing a cancer or imaging studies where you're looking at a mammogram or some imaging studies, and those finer details are important. This is gross, like there's a big elephant in the room. I don't need an AI to look for the elephant in the room.
So I'm talking from the neurologist point of view. We do not use AI in management of diabetic complications, neurological complications of diabetes, but there are some things under development, and I think AI is going to help with precision in diagnosis or early diagnosis. For example, for diagnosing diabetic neuropathy early on, one technique is used, which is a corneal confocal microscopy. So it can image very fine nerve twigs under the cornea. If you do it manually, it's very complex and you cannot come to a decision. It's difficult and time consuming, but you can use machine learning and AI to come up with an algorithm to diagnose what constitutes a surrogate for a developing diabetic neuropathy. So that's still under development. So I think AI is going to help us in those kind of things, not and it can also empower patients in fine-tuning their dietary and insulin or medication management. And there are AI tools that are in development in those areas as well. But there's no direct AI involvement, AI use that I'm aware of. And
I believe AI is being used for diagnosing the retinopathy. Almost all it is one of the standard of care, I think, at this point, and it uses AI for diagnosis.
oh yeah, that's correct. I'm sorry I forgot but that's for the retinopathy. Yeah, that's probably in use for a very long time, and that's been
So the bottom line is, the AI is as good as the data is fed into. So AI is not a doctor. AI is not a replacement of doctors, but AI can help the doctors for diagnosis, management. AI can help the patient to manage their lifestyle. Actually, I have given Shubhajit some, I just looked at the chat GPT and also Gemini, and I have got some information and I have shared with Shubhajit. Probably he can send it out. There are some links that there are different kinds of apps that you can use, changing your lifestyle depending on your lifestyle, which is needed. AI can help you in those, but doctors as such are not at this time not dependent on AI. AI has use in medicine in different fields. Actually, this I was going to tell just 1 minute. I'm sorry, taking the time. In Times Magazine, this issue in July 7th issue, there is an interesting article that one couple got a child after 19 years. The husband had agiospermia, means absence of or very negligible number of sperm cell. And they have developed one technology in Colombia. It is called STAR. It is called sperm cell tracking and recovery. And they have used the similar technology that NASA uses to find a new star in the whole universe. So they have used it, and they have found that the doctors and technicians have been trying for 19 years to find a sperm in this man's semen. And within 2 hours, the machine got 44 sperm cells, and within a few days, the wife was pregnant, and she is now in the second trimester. So this is the magic of AI, But we have to, again, the AI has found the sperm, but then everything else is being done by the doctor's team and medical team.
Absolutely, Ashok. And as I mentioned, right? So AI can be used as a microscopic. The scientist will be the doctor. And as we're talking, right? Shushanta mentioned about the neuropathy. Ashok mentioned about the retinopathy, and diabetes will hit all your organs, and with the predictive analysis AI can find the pattern. But I understand that this is really interesting topic, and we can go over and over, but I know with the interest of time and we need to close for today's session. But I sincerely appreciate all the panel members and all the participants for joining us for this information and panel discussion. And before we wind up, if you have any suggestion, any feedback, you can drop in chat, or you can reach us at secretary@bagnonline.com through email, like what do you wanted to hear from us, or what are the next topics that you would like to hear from BAG and CC. We'll take those feedbacks and we'll see that how we could move forward with that.
I have just put one comment.
So with that said, Shojit, I think we can close, right? Thank you everyone for participating, and have a good night.
Good night.
Thank you everyone.
Thank you all.
Thank you.
I saw it and I completely agree with you, Ashok. Thank you everyone.
Thank you. Thank you.